Hello everyone, I am Dr. Subhra Dhar and I am Chief of Wizderm PathLab, which is present within Wizderm Clinic, Jodhpur Park, Kolkata. Wizderm PathLab is a dedicated dermatopathology lab and only lab of its kind in Eastern India. And I am the dermatopathologist here. The skin is the largest organ of the body, but in case of skin diseases, most often a small testing sample called a punch biopsy usually suffices for a diagnosis. The punch biopsy is usually taken out by a dermatologist and collected in 10% formalin vial and sent to the lab. The good news is that the punch biopsy can be performed by dermatologists in any part of India, in any city of India. Wizderm PathLab has tie-ups with courier companies like Blue Dart and DTDC, and it is our responsibility to get the sample couriered to our lab. Our turnaround time is usually 4 to 5 days. And once the report is ready, we have provisions for sending both soft copy and hard copies to the doctors as well as the patients. Skin diseases can be broadly classified as inflammatory, infectious, or skin tumors, which can be both benign or malignant, that is cancerous. Under inflammatory skin diseases, there are conditions like psoriasis, eczema, lichen planus, and there are even autoimmune inflammatory skin diseases like SLE, vasculitis, autoimmune, blistering conditions like bullous pemphigoid, pemphigus vulgaris, etc. Infectious skin diseases like skin tuberculosis, leprosy, leishmaniasis, superficial and deep fungal infections can occur. And in skin tumors, there are both benign and malignant counterparts. Under benign skin tumors, the common ones are appendigeal skin tumors or ordinary nevus, and in malignant skin tumors, there are conditions like basal cell carcinoma, squamous cell carcinoma, melanoma, etc. But the problem is that many of these skin diseases, they all look alike on the surface. A reddish bump or a generalized rash, a small swelling or a big swelling or a large or small nodule can be a manifestation in any number of these diseases that I have just enumerated. So how is a dermatologist going to treat unless he knows what is the exact pathology of the skin disease? So here comes the role of biopsy and subsequent interpretation by the dermatopathologist. Also, in case of many skin diseases, particularly in case of cancerous skin tumors, it is important to have an early diagnosis so that the treatment can be started for the patient as soon as possible for the best outcomes.